Joining me now is Dr. Kashif Pirzada, emergency physician. Doctor, good morning. Boy, I had hoped that we were done with talking about COVID and variants, but here we are. We've got a new variant on the scene. How serious is it?
It's kind of a here we go again vibe, eh? We don't know a lot yet. It's just starting to be felt. The fear is that this is the most mutated variant since the original Omicron almost 2 years ago. And the other thing is we're starting to see an uptick in cases and hospitalizations in our hospitals in Ontario. So I think the worry is that this could be something to be worried about. We don't know a lot. It was nice to have a lull up until this point, though.
So what does most mutated mean, doctor?
So this virus is constantly trying to beat our immunity, whether we got it from vaccines or from getting infected. It's in, billions of people. It's always changing and mutating, and has enough changes that it sets it apart from the Omicron virus that most of us got in the last year and the vaccines that we got 2 years ago.
So you said it could be something that we may need to worry about. When are we going to know more about this variant, how quickly it's spreading, and what the impact is on people? Are the symptoms going to be the same as the other variants that we've seen in the past couple of years?
From what I'm seeing now, it's very similar. Loss of taste and smell, fever, chills, body aches. The real test is going to come when schools open next week, and we could see a lot more spread of this. If we start seeing a heavy load in our hospitals, we will need to do something. Maybe people will need to dig out their old masks. Think about the new boosters that are coming in 2 weeks, especially if you're sick or have vulnerable family members. And really in schools, really need to think about ventilation upgrades. It's a real good solution that doesn't involve a lot of intrusiveness. It could really prevent a lot of cases, but the real test will come next week when school starts.
So, in the meantime, you mentioned the mask. Is there anything more that we should know about protecting ourselves? And I'm asking that question because at this point, most people have put their masks away. They've let their guard down, thinking that this COVID-19 was in the past, doctor.
I think it's hard to convince people to do it again, but I understand there's a lot of fatigue. But I think for high risk situations, like if I'm in a plane, if I'm in a very crowded place, I keep one in my pocket to put on in those types of places because that's a thing that I can mitigate, right? If I'm hanging out with friends at home, I won't wear a mask, obviously. So I think be strategic about it. Do pick out the high risk spots that are in your life, like maybe that crowded train or bus, maybe a crowded shopping trip in a grocery store, and wear it then. That's probably more realistic for the long term.
Do we have any immunity, do you think, against this variant?
I think we'll have a little bit. We're not seeing the crush in our ICUs up till this point. We've been coasting on good immunity from the vaccines and from previous infections. So I hope so. But as I always say, hope for the best, prepare for the worst. Just have it in your back pocket, in your mind, that if something is going wrong around you, that you need to act. We're not hearing from the public health officials like we should to act on this. So you kind of have to act on your own, unfortunately.
And last question then, you mentioned the new booster. Will that new booster that comes out in a couple of weeks offer protection against this latest variant?
That's another thing we don't know, but the hope is that it's closer to this variant than the boosters that we had last year and the original vaccine. So in 2 weeks when it's available, I'm going to line up to get it. I don't want to get sick with this thing. And probably a lot of people should too, especially if you're getting cancer therapy, if you have a lot of medical problems. It's a good idea to boost up your protection. If you do get sick in the next couple of weeks, antivirals are available. In Ontario, you can just get them at your pharmacy. You don't need a prescription. So that's definitely an option for people as well if you do get sick.
Dr. Pirzada, thanks so much. Good to see you this morning.
Thank you.